Hi, my name is Allison Fetters, and I am here today to talk with you about your reproductive choices or your birth control options you have after this pregnancy. There is a short handout attached that you can open and view and follow along. At the end, you will answer 3 short questions to demonstrate that you understood what you saw with me today. This is why it is important that you choose the language you know and best listen to the translation of this video. First, I'm going to be talking about your birth control options. For the purpose of this conversation, we're going to be talking about how to prevent pregnancy. So we will focus on vaginal sex, which is sex that involves a penis and a vagina. First off, there are 3 things that you need to create a pregnancy: sperm, egg, and uterus. Birth control blocks 1 or 2 of these things, and it prevents a pregnancy. So we will only discuss vaginal sex because that is the only way to have a pregnancy through sexual activity. For people who are having unprotected vaginal sex without any birth control, 9 out of 10 will get pregnant within a year. A person who has both a vagina and a uterus should be able to decide whether or not they would like to be pregnant that year. Maybe they want to heal between pregnancies, lose weight, work or own a business, volunteer, or just not have more kids. Many of us love raising our children, and spacing out pregnancies allow us to have the chance to get a job, go back to school, or take care of our other health priorities. We should be able to decide how many kids we have, when it's best for us to have them, and how many kids we really want. Please look at the attached handout on the screen. The left side on the chart tells us how well birth control methods work. More stars on the left side means these methods work really well. On the right side, you can see the number of pregnancies associated with each of these methods. In other words, more stars equals less pregnancies. Fewer stars equals more pregnancies. You can decide whether or not you want to be pregnant within this year. The birth control method you choose will depend on how soon you do or don't want to be pregnant. Let's start with the orange row with 5 stars. All of these methods work really well because they are put in your body by a doctor and you don't have to do anything else once they're put in. The implant is put in your arm with a needle by a doctor and works for up to 3 years. The intrauterine device, or IUD, are placed in your uterus by a doctor using a tiny flexible tube while you're awake. Different IUDs work for different time amounts, ranging from 3 to 12 years. There is a non-hormonal IUD that works for 12 years. All of these methods are reversible and do not affect your ability to have children in the future. Last on this row is sterilization for men or women. This is the only reproductive option that is not reversible and is a permanent procedure performed by a doctor. Moving on to the green row with birth control methods that work pretty well. These methods require the user to do more in order to get them to work, which is why they don't work as well because people can forget. First, birth control pills need to be taken every day, ideally at the exact same time to work. Second, the patch is stuck on your body like a band-aid and is changed every week. Third, the vaginal ring is placed by the user by pinching the flexible ring and placing it right up next to your cervix. This is changed every month. A woman needs to feel very comfortable with her own body while using this method. Finally, the shot requires a doctor visit every 3 months. All of these methods require you to remember to take a pill or change something regularly and make sure that you are refilling your prescriptions or having your doctor's appointments to stay up to date. Now let's look at the blue row, which is birth control methods that do not work as well at preventing pregnancy. First, there is the withdrawal method. This is when a person pulls the penis out of the vagina before ejaculation, the sticky fluid that comes from the penis. This fluid contains sperm. However, this method does not work very well because the person must pull out before any sperm is released, and that is not always possible. There is a pre-ejaculate or tiny amount of fluid that is released before ejaculation for some people, so you can still get pregnant from pre-ejaculate. Second, there is a calendar method or family planning. A person tracks their menstrual cycle to know when they are ovulating and avoids having sex during those days. There are free apps available for your phone to tell you how to do this. You have to put in the first and last day of your last period, and the app will calculate your ovulation days, but it needs consistent and accurate data. Last, there are condoms. There are external condoms that go onto a penis and internal condoms which are placed inside the vagina. Condoms prevent unwanted pregnancies and protect against sexually transmitted infections. Internal condoms are helpful if you are having sexual relations with someone who refuses to wear a condom on their penis. They are also helpful because they can put in before sexual activity or vaginal penetration. External condoms need to be on an erect penis before vaginal penetration to be effective. It is essential that the person using a condom knows how to put it on correctly, but the good news is lots of practice helps. They can be bought at any drugstore. All of these methods on this bottom row are accessible, low cost, or free. All of the methods on this row must be used every time there is vaginal sex. While there are some methods that work better than others at preventing pregnancy, there is no best method of birth control. It totally depends on you. The best birth control is the method that you can use consistently every time you have vaginal sex. That is why it's important to talk to a medical doctor about your different reproductive options to decide which birth control method is for you. Lastly, we will talk about emergency contraception. On the back of the Bixby handout, we will review emergency contraceptive methods. Emergency contraceptive is a form of birth control that prevents pregnancy. It does not cause an abortion. If a pregnant person uses one of these methods, it will not affect the pregnancy. Emergency contraceptive must be used within 3 to 5 days of unprotected vaginal sex in order to prevent the pregnancy. You can either get emergency contraception at a reproductive health clinic or Plan B in the blue row, which you can buy at a drugstore without a prescription. It can be kind of expensive at the pharmacy, and you can buy it before you need it if you think you might need it. Plan B does not work as well for people over 155 pounds. A copper IUD can also be used as a form of emergency contraception, but a medical doctor must place it within 5 days of unprotected vaginal sex to prevent pregnancy. Lastly, we will be talking to access to birth control and reproductive health services. You have a right to get reproductive health services, including birth control, on your own without anybody else's permission starting at the age of 13 in Arizona. There are several clinics in this county that provide reproductive health services. Many locations offer Title X services. These clinics provide low-cost or free services and do not require documentation of proof of income. They are open to men and women who have little income, people with or without insurance, and serve people regardless of their ability to pay. They offer sexually transmitted infection testing, birth control counseling and prescriptions, sexual health exams, and treatments, all confidential. No one has to know. Many of these clinics also have interpretation services available for medical appointments, but patients can bring a friend to act as their interpreter if that makes them feel more comfortable.